Well, good afternoon, everybody. I'm Eric Linzer, President and CEO of the New York Health Plan Association. Welcome to today's webinar, Getting Started with the ACA, Practical and Tech-Based Tips. Before we begin today's webinar, I want to extend HPA's condolences to the family of United Healthcare CEO Brian Thompson, who was fatally shot this morning outside the New York Hilton Midtown in Manhattan, where the company is hosting an investor day. Our thoughts and prayers with Brian's family and our colleagues at United during this difficult time. Today's webinar is one of the many forums HPA hosts to keep members up to date on issues affecting our industry. So thank you all for taking the time to be with us. And thank you to Goodroot, an HPA affiliate member, for sponsoring today's session. The ACA marketplace continues to grow each year, with 2024 open enrollment reaching new highs of over 21 million people enrolled. Community health plans of all sizes are eager to expand into new ACA states and regions, but to successfully enter and succeed in the government-sponsored marketplace, plans need to know practical strategies and learn insider perspectives on what's working now. Today's webinar will cover both topics, helping community-sponsored and smaller regional plans accelerate their ACA paths. Joining us is Joe Boyle, President of ClearFile Solutions, a Penstock group, where he works directly with health plans to stream their regulatory processes to ensure filings are completed correctly and on time to eliminate missed deadlines, fines, and compliance issues. Joe brings his years of regulatory expertise into this role from roles including at Aetna and BMC HealthNet WellSense. Also joining us today is Kevin Deutsch, General Manager and Senior Vice President of Commercial Cloud, where he's responsible for operations, product development, and customer satisfaction, working with insurers across the country to support their goals. Kevin has developed significant industry experience through some of Softheon's largest implementations in client relationship management. Before I turn the session over to Joe, we wanted to let you know that there will be an opportunity for Q&A at the end of today's presentation. This is an interactive session, so if you wish to submit a question, enter it either in the chat section or the Q&A function at the bottom of your screen, and we'll try to get to as many questions as possible. We are recording today's session, and we will be making copies of the presentation available following today's webinar. So with that, thank you all again for joining us, and I'll turn today's session over to Joe. Good afternoon, Joe.
Thank you, Eric, and thank you, Kevin. Good afternoon, everybody, and thank you for joining us today. Very excited to share some of the content that we have to tackle some of the ACA tips for your current plan year's end 2024, and getting started for 2025 into the 2026 plan year. So, like Eric mentioned, ACA enrollment has reached record highs here in 2024, and that's due to a couple factors. Since the inception of the ACA back in 2010 and the enforcement of Obamacare in 2014, we have seen steady growth for the past decade of ACA enrollment, whether it's individual, small group, on the exchange, and off the exchange. A couple contributing factors to those large enrollment numbers was the expansion of subsidies by way of the American Rescue Plan between 2022 and 2024. So we have been seeing trends where, as CMS has allowed the expansion of subsidies, more members than ever are qualifying for APTC or advanced premium tax credits to help them pay their premiums on an annual basis. So we do see that CMS, even as recent as the 2026 Notice of Benefit and Payment Parameters, has considered to not just expand those subsidies through next year, but also considering to make them permanent for the foreseeable future of the ACA. So I do know that from a filing perspective, as we go to plan our plan portfolios and strategy for 2026, looking at all the enrollment numbers and the geographies that members are located in is going to be very important as we evaluate our plan portfolio strategies for next year. Kevin, I know that Softheon is in the thick of it, the 5th week of enrollment, so starting the 1st week of December. You're probably hard at work with your teams and everything. What have you been seeing in terms of Softheon? Any changes to your operations, any tactical implementation, or things we should be looking out for as we enter January 15th?
Yeah, thanks, Joe, and thank you to the New York Health Plan Association. As somebody who's born and raised on Long Island, and our company's actually headquartered in Stony Brook, this is a really great opportunity, and to be alongside of Joe, who I've known for many years is also a special thing for me and for Softheon. We've been in the ACA since the very beginning, and this was a very small market that has grown significantly over time, as Joe had mentioned. There's been a number of different factors and plans that got in early on. Many had a lot of trouble in this market and actually exited. And then over the past few years, you're seeing many plans actually get back into the market based on what you see on the screen here with all of the growth and how plans have been able to better manage their margins associated with this specific business. Now, of course, with what has gone on in the White House and some of the changes that have taken place there, there are certainly some potential headwinds ahead. And so far this year, it's been a little bit of a slow open enrollment. Now, CMS had just released this past week their first enrollment update, which if you're not subscribing to that, it would be really good to take a look every once in a while when CMS produces those enrollment trends. And the tone is positive from that press release. There was about 500,000 new signups so far for plan year 2025, with just about 3 million total signups, including renewals. Now, on its own, that doesn't really tell us too much of a story. If you look at the numbers from last year, it is a little bit down. However, and we'll talk about this a little bit more in just a bit, there was a state in Georgia that had moved over to a state exchange. So some of those numbers are actually removed from the counts. You're not really getting an apples to apples comparison. But generally, what we're hearing so far is that it's been off to a little bit of a slow start, but this is par for the course as we approach our December 15th deadline for January 1st coverage. We're expecting to see quite a bit more enrollment over the next couple of weeks. So we're in a little bit of a wait and see right now. And I think, as Joe had mentioned, there's going to be a lot more eyes on this next year as we look towards 2026 and whether these enhanced subsidies will continue or if they won't and what that's going to mean for the market. But we'll talk in just a bit about the tremendous opportunities that we have.
Oh, thank you, Kevin. That's a great point too. And I do think that it's very valuable too. Great reminder for everybody to sign up for those CMS updates and any state division of insurance updates that actually publish membership reporting on a monthly or intermittent update perspective. I do think, from what our team looks at, we're starting to collect the 2025 PUF files so that are published by CMS from their websites to understand membership trends and growth. So yeah, definitely going to be interesting to see how this trails into Q1 and Q2 of next year, and to see how payers are altering their plan strategies to mitigate either, finding the newest, lowest cost position or updates to their brand, and then how they're going to mitigate any membership changes. So I'm glad to have you leading the charge there as well. I think that's a perfect segue into avoiding some health plan missteps. And I think when we look at just a couple things from streamlining market entries, Kevin, you make a really good point that there was a point in time where people were withdrawing from the markets due to there wasn't the same appetite that there used to be for the ACA book of business. But we are seeing a slow trend of not just existing payers entering net new markets, but creating new payers that never existed as a competitor in the marketplace before. So we are seeing that there's a certain level of health plans getting new certificates of authority to participate in new states, whether they're bordering states or cross-coastal states from the East Coast to the West Coast. To your point earlier, even about following states transitioning from the federal marketplace to state-based exchanges. We do also see that there is a trend, and due to some of the rules where CMS will, enforce states being a FBM SP for 1 to 2 business years, we do see that some states will continue to follow that trend for years to come. When we think about simplifying operations, we're really looking to lead the charge in implementing additional automation in the regulatory space. So trying to streamline the functionality of adopting new mandates and new policies for all states across the country to make sure health plans are compliant. We do see, alongside of membership growth, expansion of subsidies, states are also publishing new state laws that carriers will need to follow specific to the ACA. So we do see that there's the federal rule, that notice of benefit payment parameters, but states are also publishing new guidance that payers should be aware of and should be following. So if you don't have a process today, we recommend investing some time and spending some time to document business process and procedures for the states that you participate in today. When we talk about improvement too, looking at the calendar, it is December 4th of 2024. This is the perfect time where we recommend our issuer partners to complete lessons learned. So taking your year in review to see what went really, really well, where you performed, and where there was opportunity for improvement, whether it's setting goals to have faster speed to market ahead of your filing deadlines, whether it's the state deadline or the CMS deadline following, depending if you're on the exchange or off the exchange, as well as seeing where some of the pain points were, where some of the controllable changes within your organization are a result of versus uncontrollable changes. So improvement we can measure in many different ways. We defined controllable changes here as things such as objections or questions from the state that comes back, pre-submission and pre-enrollment, and uncontrollable changes such as federal policy that we just simply have to change, whether it's at the beginning of the year or throughout each year. So we do understand that the ACA has been a complex product since its inception in 2014, but we do see that there's been some significant efforts from CMS and divisions of insurance to help streamline the operations and process for payers. So just a couple tips for folks to be aware of entering the new year. We all know with the holidays, if you remove the weekends and PTO through December, there's only a few business days left before we have to kick off, next year's implementation.
Well, I think Joe teed this up really nicely. And this market is full of risk, but it also has significant rewards associated with it. For plans that got in right from the beginning and grew slowly over time, they've seen this to be a really profitable business for them. Now, there's a lot of barriers that would prevent a plan from getting into this market. And I know Joe and I want to spend some time talking through that here. And I think you're probably going to hear the term regulatory compliance requirements come up quite a bit because there is a lot of compliance associated with this market. There's a lot of ACA specific rules to make sure that your plans are filed appropriately, network adequacy, the way that you're processing grace periods and terminations and every possible thing imaginable that you need to be looking out for in getting into this market. Now, once you do it and once you get it right and you continue to grow, this is a very, very profitable business. Now, just a couple that I want to call out on this slide specifically. For the Medicaid plans out there, one of the challenges that we've seen over the course of our 11-year, 12-year history in the ACA exchange is Medicaid plans were not equipped to handle premium billing and payment collection for members. Their legacy systems were built to accept enrollment information and to pay claims. Once you added in this concept of premium billing and payment collection and managing accounts receivable and grace periods and disenrollments, that really caused a major challenge for Medicaid plans when they were thinking about getting into the exchange. And fortunately, that's where Softheon had focused, is bridging the gap between those two areas. So even for the plans that did do it without somebody like Softheon and tried to build it in-house, what we've heard is a lot of the challenges have been around keeping your enrollment system and your finance and payment system in sync, because anytime that those two areas are out of sync, you're causing disruption to your members, you're causing access to care issues and the like. So I'd say that one specifically to call out is the issue with integrating these different systems, specifically around enrollment and billing. Along those same lines, when we talk about system integration, as the ACA market has expanded and as health plans have brought on different point solutions to solve this specific line of business, things have gotten really, really complex. So if you look at the pitfall, system integration delays, not just delays, but also the complexity associated with integrating these systems. At the end of the day, you have one individual who is looking for access to their healthcare. If there is any break at any point in time between all of these different solutions, there's going to be a major issue for these members to ultimately get access to the care that they need and deserve. Now, one other thing that I would also mention here is that the member journey is significantly impacted by any delays in any of these specific areas. If there's any issue whatsoever with getting access to timely data, you're going to have issues with that member journey. They're not going to be able to go see the doctor. They're not going to be able to add a dependent to their plan. So when you think of each of these areas, they are all very much connected from the time that you're getting data into your system to the time that that data is processed and distributed to all of your downstream channels to the point where that member is actually going to access care. And I know, Joe, you really start further up in the journey, but I'm sure there's a couple of these that you'd be able to speak to as well.
Yeah, I couldn't agree more that all of these pitfalls and best practices are dependencies to one another. And honestly, I think, starting with the, subject matter expertise of the ACA is really, where our team looks at, lack of regulatory expertise can be a large risk that plans need to mitigate, either entering any net new market, renewing an existing market, or other. Our team estimates that really to get up to speed with the annual life cycle of an ACA implementation, we recommend that any one person spends up to 18 months in that role to really master the art of a full life cycle of an ACA plan. We do see that there is a lot of attrition in the ACA space for folks entering these roles and then not staying with that, really putting our issuer partners at risk. So we do recommend developing a core team, if you don't have one already, to support that work and really make sure you're investing the right resources for the right reasons to the product. We recommend dedicated resources for any ACA implementation. And that's a perfect segue into planner portfolio strategy. Really, it's a matter of understanding if you have the capabilities to complete the competitive analytics and analysis in a market before you enter it, or else it can be very challenging to actually cross the hump and be competitive. Like Kevin mentioned, there's a couple key levers and drivers of how an ACA plan can compete in the marketplace. If you're not the lowest cost carrier offering the lowest cost premiums, you can compete based on brand. We have seen many carriers start to initiate rebrands or co-branding with one another, even joint ventures to some extent, or hospital verticals to help differentiate themselves in the marketplace for members during enrollment. So making sure that you have a codified plan portfolio strategy is going to be pertinent to entering any new market space. And then also leading up to making sure you're offering not just competitive benefits, but compliant benefits. We do see that the federal rules are releasing, if you haven't been following, CMS did release the new out-of-pocket max and deductible limits for plan year 2026 already. So you should be looking at incorporating these new plan designs into your portfolio for next year to make sure your plans are accurate, or else that could cause some delays in the review process pre-enrollment. Couldn't agree with you more, Kevin, on the integration points in terms of system delays. We do see that our team, when working towards enrollment, even post-filing, there's a number of testing efforts that happen between us and even the integration of enrollment. So the 834 and 820 files, even down to multiple rounds of rate testing and benefit testing to making sure what has been filed is now displaying correctly on healthcare.gov, or even for that matter, any state-based exchange shopping website. So I do think that these pitfalls are common themes. I think at the end of the day, we've seen across the country that we're really harnessing and getting ahead of for a full annual implementation. So no, I couldn't
Joe,
agree more.
I think there's one more point too that I wanted to make that maybe an oversight to not include here, and more recently it's become a bigger problem, is fraud in the ACA space. There's been a ton of, specifically in the broker space, with individuals getting enrolled in multiple different health plans and ultimately enrolling folks without their consent. And what that's causing is health plans are getting this data and then nobody's really sure which plan this member is actually enrolled in. So you may be paying claims for somebody that is not actually your member. You may be enrolling them and collecting premium payments from somebody who's not actually them. So having the right safeguards in place around fraud is becoming a bigger and bigger deal in this market. And I know that CMS is making some changes to account for some of this, but plans should also be thinking about how are you validating the members that are coming into your system are actually who they say they are, and that these brokers are legitimately licensed with you and your plan. So that's another thing that I think if we were to add another bullet to this, it would be the concept of fraud.
Yeah, and that's a great point too. And that is an increasingly increasing trend that we've seen too in terms of, I guess, the general name we've heard is ghost enrollees, in terms of being ingested into systems correctly or incorrectly. We've also seen, upon member enrollment, the simple difference between counting members, difference between a subscriber and a member, so an actual person who effectuates coverage or doesn't make that first premium payment. We have seen that there aren't many guardrails surrounding counting individuals in those scenarios. So yeah, I would love to see some guardrails enhanced around that. And that's a great point.
And I'll make one more, Joe, because you said it. One of the items that we do have on this is frequent family composition changes in the ACA market, which is a little bit different than some of the other markets that you all may participate in. There is constant retroactivity that's occurring. It's almost as if anytime somebody touches the keyboard, there's another change transaction that's coming through that may impact a member's subsidy level. It may impact what their overall premium is. It may impact the number of members associated with that plan. So being able to effectively manage all of these family composition changes, records that come into the system that may not really impact their billing, but you have to make sure it's taken into account. These are some of the nuances. So I think, Joe, maybe we want to transition forward into, it's almost sounding like gloom and doom, but there is definitely hope in this market of being able to manage it.
Yeah, I remain optimistic. And also, I think that's a perfect segue as well into the next section of, building your ACA entrance strategy. You can never invest enough time into this up front. Counting from being licensed in a state, it even takes up to, 6 to 8 months to even get a license to transact business in a marketplace, let alone develop capabilities or a codified implementation plan. So I think this is a really good point to talk about some of these considerations, Kevin, about community orientation, plan sustainability, and more importantly, financial risks. Some of the regulatory shifts and innovation that carriers really need to start thinking about if they haven't already for plan year 2026 and beyond. I think starting with community orientation, it's really important to understand the geographies that you're entering, because based on which state that you enter, we can really drill down into regions of that state on a county level or even a zip code level to understand what services and levels of care do these members need for a certain geography. Why are they going to a certain provider or a specialist? Are they getting first visit resolution, or do they continue to return visit to a PCP or specialist? If so, why? And really understanding the plan portfolio that you need to develop to serve that community, to differentiate yourself from your other competitors. We've also seen carriers start to implement more creative and more hyper-local value-based insurance design programs to help differentiate themselves from competitors, such as honing in on certain chronic conditions or diabetes care management or mental health substance use disorder. So certain key drivers, we're seeing certain benefits becoming more dominant in the space that'll differentiate carrier A versus carrier B. What is that all dependent on? That's dependent on an issuer being able to develop a provider network. It is very complicated to actually contract a provider network, especially with CMS's strengthened guidelines between essential community providers and network adequacy. So we did see a number of concerns from carriers with gaps in adequacy, even this past 2025 filing season, that resulted in delays for approvals, delays for certification, which could even put constraints on enrollment. So we want all of our carriers to get ahead of their network development for next year, making sure you're contracting with providers early as possible, and getting the rates that need to be sustainable to keep your network whole. We do think that also plan sustainability and the financial risk. If you don't have the resources on staff to support these functions, we recommend partnering with somebody who can make sure you're successful with that. It is not cheap to enter a marketplace. So making sure that your pro formas include all the core capabilities of building a network, the staff that you need on hand, the regulatory expertise, and even product development is going to be very important because we've seen that carriers can build and file plans, but if they can't administer properly, the product won't be successful. So I do think, Kevin, there's a lot of considerations here, even cross-product consistency. We are seeing emerging emerging trends, even more commonly Q4 of this year, with carriers simply creating ACA products so they can leverage other products on their shelf as well. So some states are also requiring carriers to offer ACA if they want to offer Medicare Advantage, Medicaid, or so on. Even the introduction of ICRA as an alternative product is something that we can actually look forward to incorporating into strategy for next year. So considering that product as an alternative, we'd be curious to see where that leads us. So.
Yeah, and the ICRA concept, which is in that bottom left quadrant there, ICRA, for those that are not familiar, individual coverage health reimbursement arrangement, and it's an opportunity for employers to set a defined contribution for employees to go and ultimately purchase an individual product and take more control of their health insurance as opposed to the traditional employer-sponsored coverage today. There's an opportunity. I mean, there are 150 million employees that are on employer-sponsored plans. So with this concept of ICRA, there is a significant opportunity in the individual market, specifically off exchange in this case, that would impact your strategy as you consider the ACA. So I would say that almost every health plan that we work with is talking about ICRA, figuring out how they ultimately get into this space and attract members into their off exchange products that they're putting out there. But ICRA is going to be a major, major consideration for this market going forward. And I know that, we've been having these conversations and figuring out the best way to effectively enroll and manage payments in this condition, which is a little bit different than what we're doing today for on-exchange membership. And I'd add to this, Joe, as we're looking at this slide, we mentioned it briefly earlier, the transition from the federal exchange over to a state-based exchange or a state-based marketplace. We may continue to see that trend, especially under the Trump administration, who's looking to decentralize some of what's going on with healthcare.gov and the FFM. We may see more and more states adopt the state-based exchange model, and plans need to be thinking of that as these states convert into state exchanges. And I'd say that also as plans are looking to expand into other markets, are you familiar with the nuances in those markets to be able to remain compliant and have the right systems to be able to scale and operate going forward? So these are some things, and we'll talk about solutions here in just a moment, that would address some of these items as you're thinking of your strategic plan.
Yeah, that's a great point, Kevin. And I do think, following that and getting ahead of it is only going to be favorable for any payer across the country. Encourage everybody to strengthen your relationships with your divisions of insurance, really getting a good harness on those regulatory requirements, because frankly, at the end of the day, you're right, FFM markets really cede to CMS, but state-based exchanges, we can see additional unique rules, requirements, and marks to hit. So I think that's a perfect segue as we kind of move into the next slide.
Yeah, so as I mentioned earlier, we keep talking about risks, and now we're shifting into opportunities. Well, how do you ultimately manage these risks and build your bid to get into the ACA exchange? And it really starts with expertise. I'll hype up Joe for just a moment. We got the pleasure of working with him at one of our health plans, and having the expertise of somebody that is so deep into this market in-house and on staff is certainly a critical factor. We were lucky to get to work with Joe for as long as we did. But what I'd say is, in the absence of somebody like Joe at your organization, there are solutions out there that have been in this market and understand all of the nuances associated with the ACA exchange. So expertise in avoiding some of those pitfalls, whether it be in the regulatory compliance area, whether it be in the billing and payment collection space, or any other items related to this market, having strong expertise both in-house to be built up and then with partners is of utmost importance. Now, when these solutions are being built, I had mentioned earlier that these legacy Medicaid and mainframe solutions are not built to meet the requirements of the ACA exchange. So when you consider the solution that you're putting forth, or any partners that you may be going with, you want to make sure that those systems are able to be configured to meet the specifications of the ACA exchange. the way that we always look at this is we want you to keep your core system intact, your core claims platform. We don't want that to have to be modified. We want to manage all of these ACA specific rules on the edge and further upstream. And that's where somebody like Softheon and Penstock, their clear file solution, is able to isolate a lot of that function for the ACA specifics and allow you to keep your core system intact. So you're going to want to look for something that is able to be configured in such a way that can meet the needs of the ACA exchange, and then also be able to be configured and expanded if you're looking to get into other states, if you're looking to get into other lines of business. You want that flexibility to be able to do that. And then lastly, there really is no business if you're not driving appropriate value and positive outcomes. So anything that we're doing here needs to be measured effectively to make sure that you're running a sustainable business, because without that, there really is no point in doing anything else that you may be looking to do. So with that, we need to make sure we have the right expertise. We need a system that can be adapted and configured to meet these needs, and it needs to be measured effectively so that, like some of the plans who had to exit the market, you're able to sustain. And Joe, I'd be interested in your thoughts on this piece. What we've learned is it's not necessarily plans getting into the exchange and growing as fast as possible. That actually has not been the success formula. It's more so being strategic about the markets that you're entering, about how you're positioning your plans in order to almost grow slowly over time. We've seen plans be a little bit more successful than those that jump into the market and maybe grow a little bit faster than they're ready to.
So thank you, Kevin. No, and I'd love to share some thoughts on this. And it has been a pleasure working with you and your team on some of our recent engagements. What we've seen is plans be very successful as what we call landing and expanding. So whether it's entering a state with a statewide network, or even entering a state in a couple counties, expanding those few little counties into a larger geography within the same state, we've seen plans be successful as well with a hyper-local strategy, not entering multiple states at one time, but really just having that, I guess you could say, scalable growth for a long-term strategic plan. We do recommend, if you are going to enter the ACA space for the first time, to develop a multi-year roadmap and a multi-year strategy up front to help support that financially and also non-financially, because once you are locked in, we do recommend growth at minimum, one state every other year, or if you do have a very progressive roadmap with investment and other products on your product shelf, one state per year. But we would also agree with you, Kevin, that too aggressive of a growth strategy could may not be favorable for some of our partners to sustain that book of business. So yeah, all in all, I think expertise, adaptability, and outcomes is really at the forefront of what all issuers should be looking forward to when planning for next year. And that's a perfect segue into getting to know some operations and getting your technology right. Like Kevin mentioned, both of our organizations do have service solutions as well as software as a service, but really where Penstock starts at the beginning with the filing, approval, and testing process. So really looking at the calendar again as December of 2024, we're already planning ahead through 2025 and 2026 filing season. So our team is looking at opportunities for improvement on where our partners can improve from last year, and also what went really well. So for example, taking a hard look at SURF filing access to understand what your competitors filed for this past plan year will be critical. So looking at the rate filings, the form filings, and the binder filings to see how other carriers have developed their networks, have developed their pharmacy plans, have developed their cost shares and copays is really going to be important to see how your plans and HIOS IDs stack up against your competition. Striving for earlier approvals is only going to help you, complete testing faster. And even Kevin, I think at the point where we integrated, with some payers this year, it was a seamless process between gaining approvals from state divisions of insurance and that flow of data down to Softheon. So understanding that you're standing up a process with healthcare.gov and that member eligibility application. We do see that CMS is going to change our filing process for next year in their HIO system specifically. We don't see a lot of changes with SURF. Right now with SURF, we do follow the SURF modernization project with the NAIC, but that multi-year project won't really impact plan management until about 2027. So we're trying to follow CMS with their improvements for healthcare.gov as they update MPMS and HIOS. So we encourage all of our partners, if you're not attending or registered for the RegTab webinars for next year, to actually get a seat at that table, and also enroll into all the DOI published webinars within the states that you plan to participate in. So getting a real-time look will be worth the time to actually understand what's changing and getting ahead of the changes. Allowing yourself an opportunity to pose questions to CMS and divisions of insurance will be critical as well. And Kevin, I think you could agree, both of us work with a number of downstream partners here, whether they're internal to a plan or an external supplier. So right now, I know you're right in the thick of this as we speak. So I'm sure it's going to be, I'm sure you have some thoughts to share as well.
Yeah, and what I would say is the relationship that we have with Penstock works really nicely, because as they're focused on all of the plan filings and rate setting and making sure that all of that is done effectively with CMS, where Softheon really picks up is when we start to receive those enrollment transactions and start to collect payments from members. As I mentioned earlier, one of the greatest pitfalls is being able to sync up your enrollment system from your premium billing and payments. And over time, as Softheon's matured in this market, we've been able to remove that complexity from the health plan and manage that on your behalf. So in essence, we're taking in the enrollment data as folks go out to shop and enroll in your plans, and then we're ultimately sending out that first bill for the member, collecting that premium payment, and then sending the health plan a fully effectuated member downstream for you to ultimately administer benefits and pay claims. And the one thing that Joe had mentioned that's really important to note here is that, and this is true for both organizations, we capture a ton of data in our systems, but this data is owned by you. We want to make sure that that gets completely exposed at every single part of this journey, whether it be enrollment data that you may be feeding downstream systems to payment information that you're sending off to a general ledger. So everything that we do in the Softheon space is all API based, that you're able to have access to in real time, so that you're able to have full visibility and transparency and serve up any of those downstream systems that you may have. The last thing that you want is a system of the size and scale of what we're doing at Softheon to capture this data and not allow you the appropriate access to it. So that's some of the beauty of what we've been able to develop over time. And in plans that we've worked with, we've seen a reduction from anywhere from 7 to 10 to 15 in some more extreme instances of different point solutions and vendors that are being utilized to string together this ecosystem for the ACA marketplace. So from the plan filing all the way upstream to what Joe and team is doing, to your enrollment, billing, payments, and reconciliation, this is your full end-to-end ACA exchange solution and all of the different areas that you should be considering when looking to get into this market.
Yeah, that's a good point, Kevin, too, because it's really interesting when you look at issuers completing build versus buy analyses. It's very challenging and expensive to implement capabilities, and we do see that there's a lot of folks with core specialties, whether it's upstream from the filing process or downstream with enrollment and billing. It's just really nice to say how successful we've been with optimizing that timeline and process.
And one other thing that I'll mention, Joe, one of the common misconceptions is, if you're a plan that's looking to get into the ACA exchange market, you may come and say, I need a shopping and enrollment solution. Well, that isn't the furthest thing from the truth, because you have to have this end-to-end experience with the billing and the payment system also integrated. So plans may come into the market thinking, I just need my front end shopping and enrollment, but there are so many other components to consider. And I hope that helps to illustrate that point here.
Thank you. No, great points, Kevin. Awesome. And this is one of my favorite slides as well, I will say, from a year in review. When we look at the annual life cycle of any ACA portfolio or product, some of some issuers that we've worked with do consider the filing process a seasonal body of work that only occurs between, January and June, after the May 15th deadlines pass for most state deadlines, and also the CMS June 15th submission deadlines and MPMS. But really, Penstock and our team are dedicated to this work year round. We do recommend that our issuer partners do staff this work 12 months each year, because right now at this point in time in December, we're already on the heels of completing all of our lessons learned, extracting all competitive analytics that have been published within the CMS PUF files, the landscape files, and even certified filings that are going on SURF Public Access. If you don't have a team that's looking into extracting that data for you, we recommend assigning a few resources to extract that for you and start to interpret that data, because by the time we get to January, as everybody knows, CMS will finalize the draft notice of benefit payment parameters that was already released, which could also be changed, subject to change based on the results of the election. And then issuers will have to scramble to then implement any changes that are put forth by CMS. So whether it's changes to cost shares or copays, or even how the timelines for filings. So really that February and March timeframe is really where we see a lot of scrambling going on. Recommend you to plan in advance, develop centralized project management for your work groups. If you don't have a implementation work group set up, we recommend identifying stakeholders within your organization and starting with 1 hour per week to meet with them to actually build and develop a plan for implementation, all the way up until where our team is then finalizing plan designs no later than March 15th. We do have a rule of thumb that we try to get data at least 2 weeks ahead of any state deadline. I know that's an aggressive ask, but really by March 15th, you should really have a final product portfolio that's ready to file. So really after March 15th, only changes you should be making to your portfolio would be to ensure future compliance for your plan if something falls out of compliance, but only to set you up for success in submitting in May. We did see a lot of carriers run up against the deadline because of CMS's process for plan transfers. So for those of you who do participate in an FFM or an SBM, you are well aware that a successful submission is dependent on a plan transfer from the Division of Insurance to CMS. So we can no longer go into SURF, simply submit a button and just know that it's actually on time. Don't wait until the 11th hour. We saw many times where plan transfers were not successfully made on time, only resulting in deficiency notices and potential objections and other implications, for carriers as well. We did also see that after June, there were delays in some of the, deficiencies and responses from CMS. We recommend that you do have dedicated resources throughout the year on those webinars, attending the sessions in real time. Make the time available, make yourselves available. It's going to be worth it. And I think at that point, Kevin, really after June, all of our plan portfolios are filed and we go under review. So what happens is we're really playing referee with the regulators to making sure that they're satisfied with our plan's compliance. And by that August timeframe, we're starting to get certifications. So at that point, really the data starts flowing down to Softheon. We're handing off data to your teams to making sure that members can enroll in compliant plans.
Yeah, it really is a nice transition when we start to hit that summer timeframe is when plans are able to really focus on getting these solutions stood up, validated, and tested. So in the first part of the year, there's a lot of documentation and configuration guide reviews and whatnot while you're focused on the plan filing, which is most important, because if that doesn't go as planned, then there is no entry into the ACA exchange. So once all that's complete and worked through is when you work with Softheon to start setting up the solution, configuring the platform, and then getting into testing as we approach our November 1st deadline. And then guess what? We repeat the whole cycle again, because this is a very, very cyclical business and there is really never rest, Joe. We always like to celebrate getting to open enrollment, but then we're right after it again for the new plan year. So that's why you don't even know what year it is sometimes. I think it's 24 now, but it feels like we're already in 25 planning for 26. So I get very confused.
Exactly. It's the old calendar year versus plan year shuffle. So no,
Yep.
you're right. And it's always forward looking as well. I think that just reinforces, Kevin, how this is a year-round process. But we've really been able to harness it from annual cycle. So it's interesting to say, because you can't really say the same about other products on the shelf that really aren't cyclical. If you look at products such as large group national accounts, or even, other products, off exchange, it's really interesting to think the cycles for submission and also enrollment. But yeah, I would agree with you, and I think it's just a reinforcement for planning. Okay, so I think some of the folks on the phone may be curious, well, how does this actually work, and how are you harnessing all of the activity that happens between January through December? And how are you so successful with the filing work? Well, ClearFile, we do have a software as a service solution. We do have the partnership with the NAIC and SURF, where we're able to track real-time task management and deadline management for all 50 states and US domestic territories. So even the states with multiple divisions of insurance, such as California, and even our good friend Washington, DC. So we're really ensuring that our clients are served and save hundreds of hours from farming data on their own, scaling division of insurance websites, downloading hundreds of forms and templates from CMS. ClearFile really optimizes, a one-stop shop for our carrier partners who are filing the products and developing the products. So that being said, I think, Kevin, we've really put, all of our work into a single source location for our team to actually complete the filings, as well as our clients who license the program to use themselves. So I will also say that, short of being Fort Knox, ClearFile, we are SOC 1 and SOC 2 certified, and the broader Penstock organization is also High Trust certified to keep all of your data safe. So we are proud to say that as well.
Yeah, I think that last comment that you made, Joe, shouldn't be overlooked at all, about the importance of having those certifications. I know that Softheon collecting payment information is PCI compliant, and all of these things are required as you're participating in this market. And so working with companies like Softheon and Penstock, it may remove some of the burden on your organization to maintain some of these types of compliance certifications.
Agree. No, thank you, Kevin. I couldn't agree with you more. And I know, Eric, I think maybe we could take a quick pause, just to survey for any questions here as well. Just looking at the clock, I
Yeah.
want to make sure we're on time.
Yeah, Joe, we've got about 10 minutes left. I think just as a reminder to folks, if you do have questions, just to enter them into either the chat or the Q&A function at the bottom of your screen. And while we wait for any questions, Joe and Kevin, let me just throw this one question out there, maybe to get things rolling. Can you both give us a sense of how much lead time you'd recommend for planning in advance of an issuer entering a net new market? I mean, you both talked about sort of how the years blur together, calendar year, plan year. 24 becomes 25, and as soon as you finish in early 25, you have to start thinking about next year. So can you both talk a little bit about the lead time for those organizations that might be thinking about entering a new market?
Sure. I think, well, so my first gut reaction, we recommend anywhere from 12 to 18 months would be a sustainable time frame to actually develop the capabilities or source the capabilities to enter a new market sustainably. So that would be certain things like enrollment and billing, and getting, building those capabilities, or partnering with somebody like Kevin and Softheon to making sure that you have that in-house. Developing a compliant network. So that's actually like meeting with the providers, meeting with the facilities to making sure you can cover a geography for a state that you serve. And then also developing a compliant plan portfolio. So all takes a lot of time, research, and effort. So I would say anywhere from 12 to 18 months would be our team's recommendation if you really want to knock it out of the park.
Yeah, it's never too early to start, that's for sure. I will say, though, that it's more important in Joe's area getting the plans filed and all of that. I'll repeat it again. Without that, there's nothing else that follows. But as it relates to the Softheon solution, we look at anywhere from a 90 to 180 day implementation cycle. We've built a ton of best practices working with our other health plans, which will lower the barrier for plans to get into the market. So our piece is you could streamline that quite a bit. We've had some plans come to us at the very last minute. We've been able to get them stood up in preparation for open enrollment, but really the earlier the better, so that we have enough time to configure and test and make sure that we're ready for open enrollment, which is usually that point that we're all working towards, is open enrollment on November 1st.
So as we wait for other questions to come in, Joe, I'll turn it back back over to you. I know you have a couple more slides, and just as a reminder to folks, certainly feel free to use either the chat or the Q&A function at the bottom of your screen if you have additional questions. But Joe, I'll turn it back over to you.
Sure. No, and thank you. And great questions. We'll welcome any more that folks or listeners have. When we talk about other components, just in terms of making your ACA implementation successful, when we talk about turning data into continuous improvement, there are a couple different functions, that we can talk about here. And Kevin, I know from like a benchmarking perspective, a predictive analytics perspective, I know Softheon is really leading the charge with getting ahead of some of the marketplace changes.
Yeah, the term best practices is one that we utilize quite a bit, and taking all the data in that we do across these different carriers, across different states with their unique requirements. And what I'd say is, as AI continues to grow and expand, utilizing things like AI to better understand your data and then drive your strategic path forward is incredibly important. And even more so, just to understand why the members are doing what they're doing is also a real strong opportunity. And I'll share one specific use case. There was a couple of years ago, we were trying to determine what is making members term for non-payment condition. Why is a member not making their premium payment? And through a whole bunch of data that we were capturing, both on enrollment, demographic trends, and also methods of payment that they're utilizing, whether they're signed up for recurring drafts or whether they're sending in a check to a lockbox, we were able to determine with quite a bit of confidence members who were expected to terminate their coverage. So that's just one use case that if plans are able to implement them effectively, you're able to improve your retention, you're able to improve your sustainability, and your ultimate return on investment into getting into the ACA exchange. So the real point of this section of the presentation is that you have to utilize your data for your benefit and make sure that as you're looking at these trends, you're able to make slight adjustments and ultimately to make this business more sustainable and profitable for you.
And Kevin, I will say, I'm so glad you brought that example up, because it's interesting when our team looks at strategic, I think, advisement for where plans are going with their portfolios. We do look at projected membership of what plans project that they will gain in their unified rate review templates versus the actual membership. And we also track grace period boomerangs. So for example, if a member does miss a premium payment, we try to actually track, well, how, is it the cost of the plan or total cost of care, or what are the implications or why they're not paying that premium? Because they'll only have a certain limited time to play catch up before they're actually terminated for certain reasons, which would skew different data sets. So it's interesting to think how the data comes full circle, but I think that's a perfect example of that you shared.
And then which levers do you pull, right? Which levers do you pull and ultimately to influence that end outcome, whether it's doing a campaign to get signed up for autopay or recurring drafts, or it's implementing something like Pay Now to collect a binder payment at time of enrollment. These are some of the things that we've seen that when plans aren't thinking about it, they're just seeing the end result of members terminating their coverage and never effectuating in the first place. So understanding your data, and this slide illustrates from a number of different diverse data sources. Interoperability is a term that you hear over and over again. You need to make sure that you have access to all of this data so that you can synthesize it and then ultimately make judgment about why are these things happening the way that they are. So the real high level overview of what you have on the screen here is just all of these different sources of data Hopefully it's consolidated into few systems that you can count on one hand so that you can ultimately layer on AI and get to the right outcomes for your members and make sure that you're providing them value.
Awesome. No, thank you, Kevin. I think this is great, and it's a good understanding. I mean, for full transparency, we do see. I only think that states and CMS will even strengthen some of the rules that will enforce these components over the next couple years. So I think with a couple minutes left, I know we're kind of coming to a close, and hopefully we'll get some more questions before we wrap. But really, ongoing ACA performance improvement. Root cause analyses, goal setting, competitive analytics is really the holy trinity of how we've been successful for this plan year, for our issuers, and for planning for next plan year. Really taking the time aside to invest the resources into these three components, and then holding yourselves accountable for that. I think our team has been very successful in doing that, for ourselves and for our clients, whether it's, filing different drug formularies or different business rules by plan. Each carrier that we work with has different priorities. So whether you're a smaller carrier, regional payer, safety net plan, or a large carrier, everybody's slightly different. So would just encourage you to take a hard look at how you're managing these components today, and incorporate that into your outlook for next year as well. And just finally, some, 3 different takeaways for additional success: streamline market entry, simplify operations, and always improve. Like Kevin mentioned, I think we can all agree that the ACA product is highly complex, and I think we've done a great job in simplifying the annual cycle for it. So would just encourage you guys to think creatively, and looking forward to hearing feedback through your next plan year as well.
Well, with that, Joe, Kevin, I think we've got time for maybe one more question. If we don't have one that comes in through the chat, let me just throw it out there as, there's really 2 different approaches when you talk about the ACA marketplace. One is, those states that have a state-based marketplace versus those that use the federally facilitated marketplace. What have you found to be the easier of the 2 marketplaces to work with or to implement? And that might be a fairly broad question.
We're talking to New York Health Plan Association, so we might want to say state exchange. But Joe, I'll let you take a first pass.
Yeah, I think it's always been, I've enjoyed working with the state-based exchanges a lot, comparatively speaking, because you get to really understand, a little bit more background as to the approach the state's taking to the members that we're serving. So really understanding the member population and why maybe some of the state rules are different than the federal marketplace. And it helps us advise our carrier partners more appropriately. Where when we work with federally facilitated marketplaces, I will say it can be more seemingly challenging to throw a dart at the board about what we think will change, where we actually don't know things will be changing. So personally, I've enjoyed working with SBEs more. I think it's becoming a more common trend, but each SBE is unique. So which is what I will say. So where the FFM's consistent, SBEs each year is a little bit different than one another, so it's always a little more fun.
Yeah, I think the trend is certainly pointing in the direction of state exchanges, and we should embrace that with open arms. And we're starting to even see best practices across the states as well. They may have their unique rules and requirements that's going to help benefit their unique populations, but generally speaking, we're starting to see some best practices formulate amongst the state exchanges, which make it easier for plans to operate there.
Well, we are up against it, but I'd be remiss. We did get one question, one additional question in. I'm going to take the prerogative of being the entity that's hosting today. We'll go a couple minutes over just to answer Samantha Davis's question. Guys, the question that came in is: one, for a new issuer entering the individual market, is whole state or partial the better approach initially? And as a follow-up, she asked, what's the runway time for a new issuer entering the market approximately? I know you both had talked about that a little bit earlier, but maybe touch on that again.
Yeah, so for the first part of the question, so if I understood it, it was the entering a whole state or partial state. So I would say we supported 2 net new issuers entering a new market this year that were both partial state. So we did see that was easier for the carrier to achieve a compliant network, and they do plan to expand that network to a more broad state year 2 and year 3. We recommend as long as you can codify a compliant network within a certain county and you can get that ROI, that revenue or that profitable revenue from those projected members, partial state's going to be your easiest option, but would encourage you to have an expansion plan quickly after. Don't stop contracting. You have to continue successive contracting always and often, but and then I know we already addressed the lead time, but again, the 12 to 18 months. So you should be planning for any expansion today for next November 1st already, right now.